In this presentation, we're going to be talking a little bit about mammography. There are two different types of mammograms that are performed in the mammography department. There's a routine screening mammogram that is performed starting at the age of 40. It's recommended that women get their yearly mammogram between the ages of 40 and 49. And then around the ages of 50 to 55, it is then recommended that the woman can get a mammogram every other year. That is up to the discretion of the doctor and also the patient. It also depends if the patient has had prior abnormal mammograms. If that's the case, then they may continue yearly for a while and then later down the road decide to, if they want to have it every other year. The screening mammogram consists of a cranial caudal view of each breast and an MLO, or a mediolateral oblique projection of each breast. If there happens to be some type of abnormality on the screening mammogram, the patient is then sent to get a diagnostic mammogram, which consists of spot compression views of the area of interest. It may also include an ultrasound as an additional source to see if the area on the breast is a cyst or a tumor, and they may also be sent for MRI for additional imaging. These are two images of a screening mammogram. In picture A is the MLO view. What is really important in the MLO view is that the patient is able to get, the technologist is able to get muscle. You can see this white area here. This is the pectoralis muscle. We want to try and get that on the film as much as possible to prove that we've gotten all of the breast tissue in the image. The image on the right is the right CC view. Again, we want to look and we want to see about getting as much muscle back here as we can. It is difficult on some patients to get that muscle, but it's something that a mammography technologist strives for. This is an image of a 3D breast equipment. On the top, we have the X-ray tube, then we have the compression plate, and then we have the cassette place, which also includes the grid. The 3D breast imaging is the most up-to-date technology that we have for mammograms. It's really great because it takes several slices of each breast in 1 millimeter slices. It gives the radiologist better visibility in which to diagnose any abnormalities in the breast. So it also gives the radiologist more confidence in what his diagnosis is. The time frame for 3D breast imaging is only probably just a very few seconds longer than what the 2D breast imaging was. So it's really not hindering the patient. And the radiation dose is fairly low. It's still consistent with what a mammogram was taken back when they used film. This is the front of the 3D imaging equipment on the left. As you can see, we have the tube at the top, we have the compression paddle, and then we have the cassette and the grid at the bottom. The machine, the patient will be placed in the machine. The breast will be placed between the compression paddle and the cassette plate, and then the patient will be told to hold their breath, and this machine will move back and forth and take the slices needed. On the right is the MLO view. The patient is placed again in the machine. The arm is raised, the patient turns their head away, they hold their breath, and the machine rotates back and forth over top of the breast, taking those sliced images. Whenever you get a screening mammogram or a diagnostic mammogram, even breast ultrasound or a breast MRI, it is required that BIRADS, or the breast imaging recording data system, is included in the letter telling the patient which category their diagnosis is. It goes from category 0, which is incomplete, meaning the patient is going to be recalled for additional imaging, up to category 6, which the patient has gone for a biopsy and it has proven malignant. From then, the team will decide what the best plan of action is for that patient. On the letter, must also state the type of breast density that the patient has. There's categories A through D. Um, Category A is mostly entirely fat. This is good for the patient in that it's easier to read the results because there's no fibroglandular density in that tissue to hide any abnormalities. And then D is extremely dense, which means that that patient has pretty much all dense breast tissue. It's very hard to read, so they need to take a little bit extra time to read that mammogram. At this point, there are some doctors who would recommend the patient go for further MRI just to rule out any abnormalities that are hidden within that fibroglandular tissue. The diagnostic mammogram is you'll see at the bottom of these two images, they use smaller paddles in which to compress the area of interest. What the technologist will do is look at the mammogram that was taken. They'll look for the abnormality that was circled by the radiologist. They'll find out where it is on the breast, and then they will compress that area. What they want to do is if they can compress that area and that abnormality goes away, then usually it's telling the patient that there is no abnormality there. They were able to compress it out. If that compression does not work and the abnormality is still there, then the patient will probably be sent for more additional imaging. It is harder on the patient because we are just compressing one area of the breast, so it might be more uncomfortable for the patient, but it's still tolerable. Then we go on to the ultrasound. Ultrasound can be used on its own or in conjunction with mammography. It is recommended for women who are under the age of 30. They will be sent for an ultrasound. And then if a patient is at a doctor's office and they are doing their yearly checkup and they check the woman's breast and they feel a lump or another abnormality, or if the patient does a self breast examination and they feel something that just does not feel normal to them, they might be sent on to ultrasound. Again, it's also used in conjunction with an abnormal mammogram. They might be sent for an ultrasound also because it is able to see different things in the breast than what a mammogram is. On this slide is a picture of an ultrasound. So what we're looking for is this area here on the right. You can see that it has very smooth edges around the area here, and this is a cyst. The black inside is looking at fluid that's in the breast, and that is actually what we would rather see is fluid within that cyst. On the left-hand side, you can see this is not such a smooth area. Okay, so that's an area that we want to really look at. It's also not black in the center, which means that this is more of a mass than fluid. So this would be something we would want to go and move on to do some kind of biopsy because that would be more prone to being a malignant mass. So they want to do further testing on that. A breast MRI is used for patients who are at higher risk for breast cancer, those that have a 20% or greater lifetime risk of breast cancer, a personal history of breast cancer. They may have dense tissue, as we talked about earlier. The patient may also have had a recent diagnosis of breast cancer. What the MRI will do is help the surgeons determine a better plan of action moving forward. Should that patient go and just get a lumpectomy, or would it be recommended that they remove the whole breast? So this is very important when looking at MRIs. The MRI can also see the chest wall a little better and see if there's any spread of that disease. It can check the skin and also if the nipple are involved. How long does the procedure take? A screening mammogram takes about 15 to 20 minutes. The diagnostic mammogram also takes about 15 minutes. 15 to 20 minutes. However, the patient will probably be there a little bit longer, only because before the patient gets dressed and leaves the building, they will be sitting waiting for the radiologist to read the report. The radiologist will then send them to get an ultrasound, which is in the same building. Once everything is read, the radiologist or a nurse practitioner will come out and give the results to the patient to let them know what the results were right now. Would they go for a continued yearly mammogram? Would they get a mammogram in 6 months? Or should they go for more additional testing in addition to that diagnostic mammogram or ultrasound? The ultrasound takes about anywhere between 15 and 30 minutes. Again, if it's in conjunction with that diagnostic mammogram, that patient will stay until the radiologist reads the exam. The MRI takes about 45 minutes. What should women be looking for to be able to talk to their doctor about any symptoms that they're having? Do they have a lump, a pulled nipple, dimpling, dripping, redness or rash, or changes in the skin? This is also important to note that it's not just women who have these symptoms. Men also have symptoms and come in for mammograms. They are a little harder to perform because there's less breast tissue, but is certainly something that is an option. To be certified in mammography, you have to have initial training, which is the associate's degree in radiologic technology. Once you take your registry and you become a radiologic tech, then what will happen is your employer may ask if you would like to go on for additional training in mammography, or it just may be something that interests you. So you may be asking your employer if it would be okay to take this schooling. What it requires for the ART is 16 hours of structured learning. This learning is all online. You'll do all of your modules online, and then you will take the tests and send them to the ART. You will also perform 75 repetitions in mammography procedures. You will have a mentor that will be with you as you're going through this process. They will initial each and every one of these repetitions, stating that they were there and you perform these exams on your own. They will also help you do QC testing on the equipment, look at critique and interpretation, elective procedures, and then the MQSA, which is the Mammography Quality Standards Act, also include 25 additional mammograms performed after your training, and you must have 8 hours of digital training on the equipment at the facility that you're at. Now, this 8 hours of digital training, you'll get a certificate. You need to keep that certificate because if you would happen to go to another facility, they're going to ask for that training. That way you continue to have that information. After taking your registry, the MQSA requires 15 CE credits in mammography every 36-month period. So you don't have to have 15 extra mammogram credits in addition to your 24 rad tech CEUs. They can be combined. You just need to make sure that 15 of those CEUs are performed on mammography information. The average pay and outlook for mammographers, the mean average pay in Lancaster is about $27. The mean annual wage in Lancaster, PA is around $56,000. They were predicting a 12% growth in the profession between the year of 2016 and 2026.